Hey Siri, how do you take an abdomen x-ray?
Here's what I found. The first thing you should do is perform AIDED. Confirm your patient's two identifiers, confirm the exam with the patient and the reason they are here, obtain patient history as well as location of pain, always ask patients for the possibility of pregnancy, and remove possible artifacts by having the patient remove all jewelry and anything that may show in the field of view. While the patient is changing, we can get our room set up. For an AP supine abdomen, we will be using our table bucky tray. Our tube will be at a 40-inch SID with 0-degree angulation and will be aligned in detent with the table tray. We will instruct our patient to lay on the table in the supine position with their arms away from their abdomen. We will center the crosshairs to be midline at the level of the iliac crest. To find this, we can palpate the patient's hip to find the positioning landmark called the ASIS. The anterior superior iliac crest is about 2 inches below the posterior iliac crest where we want to be centered. Make sure the light field has anatomy included from the diaphragm all the way down to the pubic symphysis. Due to the anatomy of interest, we will not be shielding for this exam. Now at the console, we will want to verify that we have the correct patient pulled up and then select our KVP and mass settings based on our patient's body habitus. Alternatively, we can use the AEC function if we are confident in our centering. For a supine abdomen, the AEC cells selected would be all 3 cells. Instruct the patient to stay still during the exposure. Explain that they will need to take in a deep breath in and let that breath all the way out and hold it out until instructed to breathe normally again. Now we wait for our exposure to complete. During this process, hundreds of excited electrons will be focused from the cathode side of the tube to the anode target made of tungsten. From there, photons will be expelled through the tube towards the patient and the IR. Now we have our results. We are able to see organs such as the liver, spleen, kidneys, and the bladder, soft tissue, bones such as the ribs, vertebrae, and pelvis, and we can even sometimes see the psoas muscles. Now we are able to evaluate and critique our image based off of the criteria given by Merrill's. We know we've properly collimated our image. Our side marker is present without being in the anatomy of interest, and we've centered our IR to the vertebral column. We also can see that we have no rotation and that we're equidistant from the collimated field based off our ribs, pelvis, and hips. We can also see our lateral abdominal wall, our peritoneal fat layer, our psoas muscles, as well as the lower border of the liver and kidneys, inferior ribs, and the transverse processes of the lumbar spine. AP supine abdomen exams can help to diagnose bowel obstructions, air or fluid within the abdomen, abnormal size or shape of organs, masses, calcifications, and foreign bodies. Typical abdominal projections can include AP upright, PA erect, KUB, lateral, lateral decubitus, PA prone, dorsal decubitus, as well as obliques. Since each type of tissue has a different effective atomic number and thickness, it allows us to differentiate between all of tissue included in the X-ray. Without the differential absorption of photons, we wouldn't be able to assess each bit of anatomy in one image. The higher the effective atomic number, the more photons that will be absorbed within that area of the body, meaning less will reach the imaging receptor. The areas with more photon absorption will show on the X-ray as a lighter shade of gray or white, while areas with lower effective atomic numbers will absorb less photons in the body, meaning more will reach the image receptor. The tissues that allow more photons to reach the IR will appear darker gray or black. The last thing to do is to send the images to the radiologist for review and to excuse your patient. You did it. You made it through an abdominal x ray. Great work.